A lot of people ask if their parents have diabetes, are they at risk of having diabetes or PCOD? Then yes, diabetes has a genetic component. So if your parents have diabetes, if one parent has, the chances are that you will be at risk. If both parents have, the chances are even more that you will have diabetes or PCOD or both. So you need to be very careful, and the main thing is you have to maintain your ideal body weight, that is your weight by height should be below 23.5. As long as you are doing that, the chances that you will develop diabetes are less. They are not zero, but if you don't maintain that ideal body weight, the chances that you will develop PCOD and diabetes will be high. Once you maintain ideal body weight, the chance is definitely reduced. So maintain that ideal body weight, that is most important. How you can do? So there are certain changes in your diet that you can make if you have PCOD, or if you have risk factors for PCOD, that is if you are overweight, or if you have family history of diabetes or PCOD, and if your periods are irregular. So if you already have these risk factors, what you can do so that you don't develop PCOD or diabetes? So in diet, what you can do is reduce the carbohydrate. So carbohydrate is something that is present in, especially in our Indian meals. Whatever we eat, we end up eating 80% carbohydrates in our diet. So how you can reduce it is that instead of tiffins that we usually eat are idli and dosa, bonda, vada, instead of all these things which are basically made up of rice, you can shift to healthier options. You can shift to pesarattu. It is made up of pappu basically. So pesarattu is a good option, oats are good option, ragi is a good option. So you can make, nowadays there are so many YouTube videos for all these recipes. You can make idli and dosa from ragi, from jonna, from oats, from millets, koralu. Again, a lot of people are now aware of the healthy things. So again, in millets also, koralu is one of the best millets that we have. And you can prepare idli and dosa from that as well. So that is one thing. For lunch, again, don't fill half of your plate with rice. That is one of the common things that we do. Eat very less rice. Ideally what we say is, if in that round plate, divide it into 4 parts and keep rice or chapati, that is carbohydrate, just in 1/4 part, just in 1/4. The other 1/4 should be some protein. So protein includes pappu, sambar, rajma, chole, meal maker, paneer, if you're a non-vegetarian, chicken and fish as well. And half of that plate should basically have vegetables. In vegetables, you can have salads like kheera, onion, tomato, or you can have lots of curries. Most of the curries are good. If you are diabetic, you should avoid potato, beetroot, sweet potato. Rest everything, green leafy vegetables and all are basically very good. So you can have most of these foods. Along with that, you can have perugu, leda majjiga. Again in the night, if you're a diabetic, specifically we say not to have a lot of carbohydrate, because if you have a heavy dinner, which is most common, like after finishing a hectic day at office, entire family gathers and the heaviest meal of our days usually are dinners. But it should be the opposite. Our dinners should be very light. Try to finish your dinner before sunset. That is our old Indian way, and that is the best way. Try to finish it before the sun sets, at least before 7:30 or 8 o'clock. And again, try to have healthy options. Try to have fulka, jonna roti, such things, along with lots of curries. And as I mentioned, for lunch, same, divide your plate into 4 parts and have other things, salads and all, much more. In fruits, again, try to have fruits rather than having juices. If you are a diabetic, you need to avoid certain things like mango, banana, sapota, sitafal, green grapes. Again, not completely, but you can consult an endocrinologist and we'll tell you how to eat even mango if you are a diabetic during mango season. A lot of our patients come and say that they love mango and they cannot live without it, but they have diabetes and how can they eat it? There is a way you can eat mangoes. You can come to us and we'll just give you a chart just for that as well. So that is how you can modify. We never tell you to stop completely anything, but according to how your blood sugar levels, if you have not so severe diabetes, if you have mild diabetes, we can make things for you in which you can enjoy food items as well, but of course everything in moderation, nothing in excess. Other than that, half an hour of physical activity. which can be as simple as a walk, but it should be a very fast walk. You should sweat and your heart rate should go up. So half an hour of walk daily is going to help a lot in preventing a lot of things like diabetes and PCOD, and if you have it, to maintain the blood sugar levels as well. So this is what my message will be. If you have PCOD, the central part to your management is going to be your food habits and your exercise, and then based on your symptoms, different symptoms, we give you treatment specifically for those symptoms based on that.